Hey everybody, it is Dr. Tim Harrigan. I wanted to talk to you about a question we get pretty much daily now, is how do we use these lasers? Here's how I use it personally. Literally put myself under a laser every time I come to the office, literally every time. That might be 4 times a week, 5 times a week, 6 times a week. There's 9,200 studies supporting these. There's 0 side effects. They're class 2 lasers that have 0 side effects, but incredible results on almost anything you could think of. Every physiotherapy you've ever heard of doesn't come close to what these do, even all of them combined, okay? So these lasers are incredible. I'm always lasering myself. I may come in one day and I tweaked my shoulder during a workout, okay? So of course I always want to work on maybe some of my ailments or things that don't feel perfectly, whether it's aches, pains, discomfort. So that's always the first thing I tell people: laser the most uncomfortable areas of your body first. Maybe it's your neck, maybe it's your lower back, maybe it's your ankle. Let's say you come in one day and you have 2 areas that are about equal. Let's say my neck is like a 5 out of 10 on a pain scale, and let's say my knee is about a 5 out of 10 on a pain scale. So the first criteria was whichever one is the worst. If they're the same though, I'm gonna ask you which one's been there longer. So if I've had knee issues off and on for 10 years, and I've only had a neck issue for a week, well, I'm probably gonna say let's laser the knee because it's been there longer. It may need more help healing. So the first one was whichever area feels the worst on you. That's number 1. The second criteria is if you have 2 areas that are equal, just pick the one that's been there longer, maybe the more chronic one. The third way to pick lasers, if after those are all taken care of, is basically I want you to still laser areas that have been a chronic problem even a few times after it starts feeling better. So let's say I've lasered my lower back 6 times. It's gone. I show up one day and my low back pain is completely gone this visit, which is incredible. However, I'm still gonna want you to laser that chronic area a few more times probably. Remember, how we feel does not determine how we function. So can we all agree that there's probably still some scar tissue in there? There's probably still some healing that has to happen in the disc or the muscle or the tendon or some inflammation. Even though it feels pretty good, there may still be some dysfunction that the laser will help with, okay? So that's the third criteria. Keep lasering something even after it feels better to allow it to heal even more. The fourth criteria is your brain and gut. Your brain and gut are the 2 most important areas of our body to take care of, and most people don't do a very good a job at that. I mean, when was the last time you took care of your brain, right? What do we do as far as brain therapies and things that strengthen our brain? Not many people do this stuff. How many, of you have been doing things for your gut? Most people have, heartburn, they have diarrhea, they have constipation, they have bloating after they eat. So our brain and gut, your gut is your second brain in fact, also need help healing over time. So if I come in and my body's feeling pretty good, I don't have that first criteria where maybe my shoulder's bothering me, maybe I don't have a couple areas that are about the same. Now I just want to go to my brain. I may laser my brain today while I'm here, and then tomorrow when I come back in, I may laser my gut. So even when the body's doing incredible, I still go back and forth lasering my brain and gut because they need a lot of help. Our gut is how we assimilate and absorb nutrients. It's also 80% of your nervous system, and your brain controls everything. There's 30,000 billion chemical reactions that occur in our body every second, and this is what controls all that. So the brain research is incredible. A great book is called The Brain's Way of Healing, and we all know our brain and gut just need to be taken better care of. Enjoy.